they said, you know, you need a bypass. And so that got my attention, and I started thinking, this is going to be not only life-threatening, painful, but it's going to be expensive.
We went in and we did the x-rays. We did about 6 different x-rays, and he tells me it's broken, but we don't have to cast it.
In the back of my mind, I remembered people telling me, Bob, we can help you with this stuff.
So I decided that this is what I should do and give it a shot.
They explained this Premier Provider program, put me in touch with an extremely qualified arterial surgeon.
Because our facility is physician-owned, we've taken a giant bill and reduced it to a fraction of what the large institutions charge for the same thing. But a greater percentage of that, a greater amount of that, actually goes to the surgeon who is performing the procedure.
It didn't cost a dime out of my pocket. It obviously saved the plan money, and it saved my bank money, and it saved me money. So it was a win-win-win for all of us.
We've been in the program for 6 months, and we've saved roughly $300,000.
The employers have saved $8 million, but the employees have saved their entire out-of-pocket when they've had one of these encounters.
This is substantial money, substantial money.
Think about the complexity that having a surgery for an employee has. So you typically get a bill from the physician, you get multiple bills from the hospital, you get a radiology bill, you get a pathology bill, you get consulting physician bills, and then anything you have after you leave the hospital. So you could have 16 different bills. Well, now they get one bill. I mean, it's hard enough being a sick patient and struggling and the recuperation, and then you've got to worry about 16 pages worth of bills. It's nice to not even see that.
The psychological aspect of any surgery is half the fight.
All I did was call the 800 number off my little postcard.
Then they set up all the appointments for our employees after that. Our employees are just raving about the service here.
Galen and Canda took care of everything. They set up the appointments, they made the connections, we got 3-way phone calls, we timed everything. They made it very easy on me.
It's concierge service, that's what it is. They make all the future appointments for our employees.
And made it so simple. I just was just so thankful, so thankful.
They know, as they pay premiums for the health insurance, as the company does, they know they're helping keep the costs down.
I feel like I'm helping, because you feel like it's just like the whole situation, medical care is so out of control. The cost. And this way, we're helping.
And in doing that, by having the arrangements that Advantage Health does with these facilities and doctors, it obviously saved the plan money, and it saved my bank money, and it saved me money. I mean, you guys just didn't go out and find some voodoo doctor out here in the sticks. You've got good quality people.
If your quality decreases, you're going to have more readmissions, which eats away at that one cost. You're going to have increased complications. To treat those complications, the costs go up, so less of your bundle payment goes to profit. So it forces us to be higher quality.
I couldn't have asked for better service.
We know that the patients and the companies are paying. They're great patients, they're great companies. We're excited, my staff is excited to be able to have these patients walk through our door and for us to grow this.
And that was done at McBride Orthopedic Hospital in Oklahoma City. You can't get any better than that. I mean, they work on the Oklahoma City Thunder. You know, what else can you say? I mean, if Kevin Durant will let the guys work on them, I'm in, you know?
And I've told them, each one of you need to partner with a TPA like Kempton that is not trying to have any hidden agenda, but they're simply trying to take a product they know works well and grow it.
We told our employees, if you're going to have a procedure, you're talking to your primary doctor, and he or she recommends a procedure, call timeout, say, Doc, I gotta go make a phone call. And we gave the number of the Kempton company, go make a phone call.
Every chance I get when someone says they're having an event, a medical event, I say you need to pick up the phone and find out what your benefits are, because they are very substantial.